Hi, my name is Melanie Heatherington. I have a master's degree in educational psychology from the University of Alberta, and I'm currently working as an education specialist for the Office of Lifelong Learning and Physician Learning Program, as well as a research coordinator for the 5A's Team Program for Obesity Prevention and Management in Primary Care. My career path hasn't always been straightforward. I had originally intended to become a psychologist working with young offenders. However, after grad school, my circumstances changed and I became more involved in the research world instead. Though my work in obesity prevention and management is quite a bit different from the work that I intended to do with young offenders, graduate school taught me a lot about research. What makes a good research project? What makes a good question? The importance of using standardized procedures and protocols. I learned a lot about ethics and good ethical conduct, and I've been able to apply the knowledge that I've learned during my grad program throughout my journey as a research assistant and now as a research coordinator. Following grad school, I began working as a research assistant on a project which looked at improving the health and wellness of low-income families by connecting them to existing services within the community. I was involved in interviewing the families and really learned about their lived experiences. This was an eye-opening opportunity. So often, researchers choose their research questions and topics without consultation with the populations they want to affect change in. What we as researchers may think is important may not actually be important to our target population. And if we want to see change occur, that's really necessary. I began working as a research coordinator in 2015 with Dr. Denise Campbell-Shear, who leads the 5A's Team Program. And from there, my career really took off. As a research coordinator, I'm responsible for making sure that all of our milestones are met on time. I coordinate and supervise the research assistants, help with data collection, creating procedures and protocols. I help put together grant applications, budgets, and publications. I handle a lot of the background logistics to make sure that our projects run smoothly. I also learned a lot about obesity prevention and management that I never would have known otherwise. As an education specialist, I also help with the development and facilitation of educational programs to improve physician practice, which includes webinars and courses. We do a lot of patient-oriented research here as well, and involve people with lived experience in all aspects of the research, from project development all the way to dissemination of our findings. One of the projects that I've worked on that I'm most passionate about is in the development of a training program to help physicians and healthcare providers have more successful and meaningful conversations with their patients about obesity. I've also helped to form an international coalition of medical educators, researchers, and interdisciplinary healthcare providers to help improve obesity education around the world. I've had the opportunity to connect and engage with people as far away as Brazil and Thailand and hear about initiatives that are going on in their countries. So, although my career didn't turn out exactly the way that I had envisioned it in the beginning, I've really developed a passion for working in this area, trying to improve the care that people living with obesity receive from their healthcare providers. I enjoy the work that I do, the people that I've met, both people with lived experience as well as colleagues from around the world. My best advice to grad students out there would be to keep an open mind. Your career may not always go in the direction that you planned it, but your journey can still be a rewarding experience.